How is TURBT, transurethral resection, performed? TURBT, or transurethral resection of bladder tumor, is a key procedure for diagnosing and treating bladder cancer. It allows doctors to remove tumors from the bladder lining without needing to remove the entire bladder. This is done through the urethra, which means there are no external cuts involved. The procedure starts with the surgeon using a thin, rigid tube known as a cystoscope. This cystoscope is inserted through the urethra and into the bladder. It has a light and a camera, which helps the surgeon see inside the bladder on a video screen. Once the cystoscope is in place, specialized instruments are introduced through it to remove the tumor tissue. A common method involves using a small wire loop that cuts the tumor while applying an electrical current. This helps to cauterize the area, reducing bleeding. Before the procedure begins, anesthesia is given to the patient. This can either be general anesthesia, where the patient is completely asleep, or spinal anesthesia, which numbs the lower half of the body while the patient stays awake. The entire surgery usually takes between 15 and 90 minutes, depending on how many tumors there are and their sizes. In some cases, advanced imaging techniques may be used during TURBT. For example, blue light cystoscopy involves a special dye that helps the surgeon see cancer cells more clearly. This can lead to more complete removal of the tumors. After the tumors are removed, the tissue samples are sent to a laboratory. There, they are analyzed to determine the stage and grade of the cancer. Following the procedure, a catheter is often placed in the bladder to help drain urine until any bleeding stops. Most patients can go home the same day after the surgery. However, some may need to stay overnight in the hospital, depending on their overall health and how extensive the tumor removal was. It is common to experience some discomfort, especially during urination, for 1 to 2 weeks after the procedure. Overall, TURBT is a minimally invasive and effective way to manage non-muscle invasive bladder cancer. It not only helps in diagnosing the condition but also in treating it while keeping the bladder intact. After TURBT, doctors may recommend follow-up treatments, such as intravesical therapy, which involves delivering chemotherapy or immunotherapy directly into the bladder. This helps target any remaining cancer cells and reduces the risk of the cancer returning. Always consult with healthcare professionals for personalized medical advice and to discuss any concerns regarding the procedure.